Advances in the diagnosis and treatment of Alzheimer's disease are bringing hope to those with the devastating condition. Dr. David Winter is here to help us explain all of it. Good morning, Dr. Winter. First, I want you to tell me, how would you know if we are developing memory issues that might indicate Alzheimer's, and what needs to be done to diagnose it?
Yeah, the early tips usually come from the patient or from the family when they describe the patient is frequently losing things, gets lost, maybe apathetic, shows a little interest in doing things they used to enjoy, maybe outbursts of anger, some delusions, depression. Any of those things will lead usually to a mental status exam. That's a question and answer that we talk about that test different parts of the brain. If that shows some deficiency, then often when you get specialized MRI or CT scans, what we're looking for is in the middle of the brain, the hippocampus, which is right here, usually starts to get some little clumping of protein. There's this particular view on the imaging study, and that spreads to the rest of the brain over years. Now, the clumping then leads to scarring, and so treatment is important. You want to try to prevent or turn off the clumping before it starts to turn into scarring in the brain.
And speaking of that treatment, how can Alzheimer's disease be treated?
Yeah, there are a couple drugs that have been out for a while, donepezil, memantine. Those have some benefit. A newer drug looks like it may be even better. They're talking about up to 70% slowing down or maybe even improving symptoms. It's called lecanemab, and it's an IV drug. The others are pills, but lecanemab is an IV, usually given in a doctor's office or a clinic every couple of weeks. So new drugs are out there, some promise with that.
And can Alzheimer's run in families? Is it genetic?
You know, there's a genetic test for it, but here's the problem, Tashara. A lot of folks that get Alzheimer's have a negative test, so that didn't help. And then if you do the test and it's positive, many of those folks don't get Alzheimer's. So boy, that would make you nervous if you have a positive test. So that test isn't very good. There's a blood test now. It's called p-tau217. Funny name, it's called Add Detect in the pharmacy number. That's what they call it. And that may have some benefit also right now with early detection.
Okay, so I want to ask this, are there things that we can do now to decrease our chances of getting Alzheimer's?
Tashara, studies have shown that if you do these things, you may, and you're destined to get Alzheimer's, it can delay it up to 10 years. What are those things? Control your blood pressure, control your blood sugar, your blood cholesterol, don't smoke, exercise. We should be doing those things anyway. Those are good for the brain, they're also good for the heart and the rest of your body.
Okay, coming up ahead. Thank you so much, Dr. Winter. Appreciate you joining us.